There was a lot of talk today about statistics, as far as, especially concerning the metrics used to gauge how much of a problem cancers are, things like that. What are the revelations that your organization has discovered?
We see that the number of cases of people who had cancer increases during the last 10 years. All the cancers are not related to tobacco use, but a lot of them, more than 10 forms of cancer, are directly related to smoking. So we can see that smoking in Quebec has an impact also on the number of cases of cancer.
And is this just a deal where the research shows that smoking is linked to more cancers than originally thought? Or is this a deal where you think that there is a higher incidence of smoking somehow that's causing these extra cancers?
I think there is an increase of the risk associated with smoking for the people who smoked many years ago, who started smoking many years ago, because the phenomenon is as it is, you know, people start smoking. People who had cancer in the last year, for example, start smoking 30, 40 years ago, 50 years ago. So that's the result of the situation we had, you know, 40, 50 years ago. And at that period, we had a lot of people who were smokers. So I'm not surprised that there is an increase in the number of cases of cancer, and it's probably what's going to happen in the next years too, because, you know, a lot of people smoke more than what we have now, and because of that, the result is we have more people with cancer in 2012.
At the same time, heart disease and the pulmonary diseases did not go up significantly. So how do you explain that?
It's hard to explain. We don't have enough data to see why, because the data that we showed this morning doesn't permit to you know, isolate the cases associated with smoking, because the database we use, the National Health Institute use, they didn't permit that. So it's only give us, you know, an idea of what happened for the whole population about four types of diseases. But if we were in the situation to see how the case related to smoking, maybe that could show a difference, an increase. But we don't have that information right now.
Thanks to campaigns and repeated efforts by the health officials to decrease smoking over the last years, have you seen an increase, a decrease, or just a plateau of the situation?
For the last 7 years in Quebec, it was a plateau. We almost have the same percentage of smokers now in 2012 or 14 than we had for 7 years ago. And that's bad, because when we look at what happened during the years before that period, we can see that we had a regular reduce in the prevalences of smoking by maybe 1%. Even some years were 1.5% of reduction of smoking. So we really have that. There is more to do here in Quebec right now because of that situation, because with 24% of smokers, that's a lot of people. That's 1.6 million smokers who are still smoking here in Quebec in 2014. That's too much. That's one of the provinces, Quebec, that has the highest rate of smoking in Canada. So that's why we have to do more, and that's why we do that campaign to really have people think about the situation and see how they could maybe decide to quit smoking.
But
we hope so.
Are those campaigns working then? If it's been a plateau for the past 7 years, do you have to try something new?
Yeah, it is working, but that's not the only way, you know, to make progress. That's not only the only campaign also that we are doing each year. We are offering services like the quit service, the quitting services with J'arrête Quit line. It's part of the offer to the whole population, but because of different situations that we had in the past, for example, we had a problem with the tobacco smuggling during the recent years. Now it's more managed in a better way, but we had a big problem with that. So people didn't want to quit smoking because cigarettes were very cheap at that moment. So it's all it's a combination of many factors who influence people to quit smoking. We have to do work and prevention to make sure that kids don't start smoking. We have to help smokers who want to quit smoking. We have to have a good regulation to make sure that the population is well protected. So that's a different measure that could make a difference. And we work on different measures, but we have to do more. And one aspect is by having a better law here in Quebec. That's a very good and important way. Another aspect is to increase the price of cigarette. Cigarette is also the cheapest in Canada, here in Quebec. So we have to change that because as far as cigarettes are cheap, people won't decide to quit smoking as much as it was higher. So that's different measure we have to work on.